Optic atrophy is a disease which affects optic nerve. And what is optic nerve? Among the 12 cranial nerves, this is the second one. And this is the nerve which starts from the brain and ends in the eyeball, inside the eyeball. This is what is in the optic nerve. And the function of this nerve is to conduct the image or impulse formed inside the eyeball to the brain. That is the function. So, any disease which affects this nerve, directly it will be involved with the vision. Now, visual defect is a compulsory symptom in optic atrophy. That is the importance of this particular disease. And the optic nerve itself has an importance, that is, all other cranial nerves are branched. It starts from the nerve, this brain, and it is getting branched, and one branch to this side, another branch to other side, like that. It supplies various structures or various sides of the same structure, like that. But as far as this optic nerve is concerned, it is a bundle of nerves. Actually, it is a bundle of nerves, and there is no branches to that. It is starting from the brain, ends in the eyeball. So, only some changes in its optic pathways. There is a pathway which to this particular nerve, and in this pathway there is some changes. Some nerves are deviating to other side, like that something happens, but there is no branches. It is not supplying any other structure. So, any disease of the nerve will directly affect our vision. This is a type of, there are different types of different types of optic atrophy. It may be primary optic atrophy. That means it is as a first stage itself, it is starting from the optic nerve itself. Second, other group is secondary optic atrophy. That is developing as a complication of or as a sequel of other diseases. There are so many other diseases which may cause optic atrophy. Among this, primary optic atrophy is really very difficult or very serious, and vision loss and visual defects is a compulsory fact. And for that, treatment also is in a particular way. The secondary optic atrophy may develop from many other diseases. Maybe some other disease of neighboring structures, or the brain central nervous system, or even sinusitis or nutrition deficiencies, and so many other diseases also may cause optic atrophy as a secondary stage. For that, we have to consider that the primary disease also in the treatment aspect. If it is persisting, that should be controlled first. Otherwise, it will be developing again and again. That one route or one channel is developed, so it may increase in its own way. It doesn't mean that only the treatment of that previous disease, maybe any other disease. Even other disease of the eye leads to optic atrophy. For example, glaucoma may lead to optic atrophy, or even some types of retinopathy changes will lead to optic atrophy. And the neighboring structures of the head region, that is in the ear problems or sinus problems, or that type of case also may lead to some changes on the optic nerve. That both disease should be controlled with equal importance. And once it is happened, the treatment should be in that level only. In Ayurveda, handling this particular group is in a particular manner. We know there is the regeneration of nerve cells is not possible. Once it is degenerated forever. That is the importance of the nerve tissue. If we are considering the blood tissue, blood cells, or the cells of bone or flesh, etc., it is or epithelial in the skin, the regeneration is highly possible. It is very easy to develop new cells. But nerve cells, when it comes to the nerve cells, the regeneration is very difficult and almost impossible. So the aim of the treatment changes in Ayurveda or in any system to make more healthy or to make the existing cells more healthy and more functionful, so that the problem will be solved to a great extent. In Ayurveda, there is a particular group of medicine known as Rasayana. Property of Rasayana means to maintain the ratio of the dhadus. Dhadus means the material body of a human being is made up of 7 dhadus. Rasa, Rekta, Mamsa, then Medas, Asti, Majja, Shukla. And all of this body is made up of these 7 things. And these basic elements of Ayurvedic theory, that is Vata, Pitta, Kapha, these 3 factors are acting on these 7 dhadus. And the signs and symptoms are manifested on these dhatus. So we have to see which dhatu is affected in a particular disease. That is very important. In the case of optic atrophy, we have to consider Vata as the dominant factor. And we have to use Rasayana drugs. There are some drugs in drugs means raw materials or other any drugs having this particular property of Rasayana Guna. Only that type of drugs will act in a degenerative disease. So we had to select some treatments and drugs which is having particularly 3 properties. One is having Rasayana property. Second is it should act on ophthalmic tissues. That is, it should have a site of action in the cells of ocular system. In Ayurveda, that particular property is known as Chakshusha. So we have to select that type of drugs only, that is having Chakshusha property and having Rasayana property and also Vata Shamana property. A combined action of these 3 will give good results. So while handling a optic atrophy, we have to consider these 2 things mainly, whether it is primary optic atrophy or secondary optic atrophy. If it is primary optic atrophy, we can directly go to the treatment of that alone. If it is secondary optic atrophy, we have to consider both the first level disease and along with the treatment of the complication, that is optic atrophy also. And while coming to the treatment side, we have to consider these 3 points according to Ayurvedic theory, whether it is Vata predominant, and then we have to select Chakshusha drugs, and also the drug should have the Rasayana properties. When everything is acting together, we will get a good result. And also we have to consider one more thing in the treatment side. We have already seen that this optic nerve is a direct extension of the brain stem. So the treatment should not be concentrated only in the eye. The treatment should be done on the head region also. There are many treatment procedures in Ayurveda to be done on the head to act on the brain stem. Just like Shirovasti, Shiro Udvartanam, Shiro Dhara, Shiro Labanam, these are highly effective treatment procedures. We have to select that type of procedures to solve this problem, because these procedures will act on the brain stem easily, successfully. There the medicine also should have the properties of the Vata Shamana like that. So it is important that don't concentrate the treatment in the eye alone. We have to consider the CNS and the treatment procedures to act upon that system. Side by side, there are many effective oral medicines or internal medicines to control this optic atrophy problem. So, we have to do three things together. One is oral medicines, second is very particular ophthalmic medication, third is treatment procedures to be done on the head region to control or to solve the problem of the optic nerve. When we do these three things together, the result is very successful. We have already seen that there are different two types of optic atrophy, and in secondary optic atrophy it may come by different sources. So, in general we can say that we have to consider our lifestyle and nutrition, dietary factors also to solve the problem. Because I have told that there is some raw materials having Rasayana property. That type of factors are there in our dietary factors also. Fresh vegetables having antioxidant properties, that will be highly effective, and also different activities which will promote our central nervous system, such as meditation or pranayama or even some eye exercise. This will give some positive changes in our brain stem. That anyway, optic atrophy is a direct extension of the brain stem. So, some activities which will improve the functions and properties of CNS or the brain stem, that will help to solve the problem of optic atrophy. So, try to practice some activities such as these things, and also have good dietary menu. This will help to solve this problem, but be very careful. It should be under the direction of an expert only, because there are different types of yogas or postures or exercise, etc., and from them we have to select which is effective that particular patient and in that particular clinical stage, and among various dietary supplements which is more suitable for that particular patient. Because according to Ayurveda, there are different types of body constitutions. We will say that dosha prakriti, vata prakriti, pitta prakriti, kapha prakriti, and its combinations. So, which diet or which food items is more suitable for that particular person, that can be told by an expert hand only. So, if that patient is using that particular thing which is suitable for his body constitution and for that particular disease condition, the selection is very important.